So this afternoon, we have 3 panelists with us. Let's see how many of them are available. So they are all on the call. We have the first one, Dr. Oliver Kome. He's an infectious disease specialist and also the acting head of the Ghana Infectious Disease Center at Ghana East. We also have Dr. Emmanuel Peku, who is a veterinary doctor, and he is the Metropolitan Veterinary Doctor for Tema Metropolitan. We also have Dr. Pupulampo, who is an infectious disease consultant and the head of the Infectious Disease Center at the Korle Teaching Hospital. So I'm your moderator. I mentioned my name already, Dr. Anita Agwasare, with the Public Health Unit of the Korle Teaching Hospital. So before we take our pre-tests and start, please let's have a quick word of prayer. We are praying. Our Heavenly Father, we thank you for this afternoon's event. We commit ourselves into your hands. As participants, we ask for concentration to be able to absorb everything that we need to learn and take away from this event. And also as panelists and moderators, we ask also for your help. We ask you to actually teach through us so that we'll be able to achieve the required minimum knowledge level to help us as healthcare workers to manage our patients well. And we also commit the staff, the internet, connectivity, IT, and everything else into your hands, that you help us to have a stable event and let it go as planned. In Jesus' name we pray. Amen. Okay, so we'll be putting the pre-test and the post-test within the chat box soon. And we have about 10 minutes to respond to it. And then we'll start, right after 10 minutes, we'll start the webinar or the modules. And then we'll leave it a bit for some of the late comments to come and then also catch up on it. After a while, we'll close the pre-test. So please expect it soon. Thank you. Okay, so we've got quite a number of responses. So whilst the others are completing their pre-tests, I'll introduce our first panelist who would start the presentations. So this is Dr. Emmanuel Peku, who is the veterinary doctor in charge at Tema Metro. So the Tema Metropolitan Veterinary Doctor. He will start with the epidemiology and pathophysiology of rabies. And then Dr. Komi will come in with the management of dog bite cases in humans. He will highlight as well some of the surveillance practices, the basic ones that healthcare workers we need to know. And then we would have Dr. Peku coming in finally again with the integrated bite case management, where we look at the intersection between our roles as both human and animal health care workers. And so we'll go ahead and start the presentations. Dr. Peku, please, are you ready? Are you able to share your slides?
So I'm ready. Thank you so much, Dr. Asare. I'm grateful for the opportunity given. Please, am I being heard?
Yes, please, we can hear you loud and clear.
I can hear you.
Okay, thank you so much, and good evening to everybody. We hope that today we'll be able to allay our fears when it comes to rabies, because I know that over the years, sometimes when you mention rabies, a lot of people get scared, but it's very good that we get the facts, and then once we have the facts, we'll be able to take appropriate measures in order to prevent ourselves from getting rabies as healthcare workers and the public as a whole. So this will just be my outline for my presentation. We'll look shortly at a definition of rabies, what rabies is about. We'll also look at the epidemiology, the geographical distribution, and the burden, how severe rabies is. And then we'll look at reservoirs, the animals that ensure that the virus or the disease is still with us. And then we'll look at the pathogenesis, how this whole thing is being developed in the animal and then even the human as well. So I will start by saying that rabies is one of the oldest diseases that we've ever talked about, and there are so
Sorry,
many.
Doctor.
Yes.
Please, we can't see your screen at all. Could you pull it
Sorry.
down and then share it again? Reshare.
Okay, let me do that. Sorry.
Thank you.
Okay. 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 Please, is that fine? Can you see the screen now?
Yes, please, we can see it. Could you try putting it in
Yeah.
slideshow?
Yes, so that's what I'm doing. Can we see it now?
Yes, we can. Thank you.
Thank you. Thank you so much. So there are so many pathogens that causes diseases. We can have bacteria, viruses, and all that. So it's actually a viral disease, and very soon we'll see what virus causes rabies. It's zoonotic. When I say zoonotic, and it simply means that these are the diseases that can move from animals to humans, and then vice versa. In fact, rabies has been one of the neglected tropical diseases, as most of us are aware. There are so many neglected tropical diseases that we find in our parts of the world, and rabies is one. One key thing is that every pathogen, once it enters your body or it enters, it needs a predilection site in order to cause the problem that it wants to cause in your body. But rabies, the virus has affinity for nervous tissue, so it causes a progressive and a fatal inflammation of the brain, the spinal cord, and other nervous tissues. In fact, when we get to the pathogenesis, we'll know more about. But one key thing here that we have to take note is that it causes a progressive inflammation. That means that once the disease starts, or once the manifestation of the clinical signs starts, it progresses. And this is very characteristic of rabies. The disease is invariably fatal and is the most painful and dreadful communicable disease that we can ever talk about. A disease that really leaves its patients with no hope. Someone is actually thirsty for water, but he cannot drink, all because of the damage that this virus can cause. And another name that rabies, another name is hydrophobia, which is fear of water. So there is no cure once clinical signs of the disease has started showing in an individual or in an animal. In fact, rabies affects all mammals or all warm-blooded animals, and most of the times, developing countries like Africa and Asia, which includes Ghana, you can find this disease mostly occurring. Unlike other diseases like COVID, probably TB, and other diseases that even Ebola, case fatality may not be approaching 100%, but rabies case fatality is almost 100%. That means that if somebody gets rabies and someone gets COVID, probably a COVID patient, we've seen a lot of them recovering, but with rabies, we've literally heard of people recovering from rabies. So that means that you can count the number of people that have been affected with rabies and have recovered. However, the disease is also 100% vaccine preventable. But this one gives us a lot of hope. And one thing is about the 100% being vaccine preventable, I always emphasize that there are two ways to it. One is ensuring that the main reservoir or the vector of the disease has been vaccinated. And secondly, once any person is bitten by any dog, taking the prophylaxis timely, or taking the human vaccines timely when you are bitten by a suspected dog. So it's a two-way affair. Once these things are done concurrently, you are sure that you are safe even when you are bitten by a rabid animal. One key thing is that most bites from domestic dog constitute almost about 99% of most of the rabies cases we've come across. And the sad thing is that it actually happens in communities or in places where they cannot afford not afford this post prophylaxis exposure vaccines, or they cannot afford the human vaccines when they are being bitten. And this has actually attributed to a lot of people actually dying of the disease. Rabies still remains one of the underreported diseases that affects very poor populations, as we've mentioned earlier on. Clinically, we have two forms of the disease. We have the ferrous form, which is mostly characterized by hyperactivity and then hallucination. So you have an animal having rabies, having a change of, he's not able to coordinate well. He's running after inanimate objects and all that. So in short, you have these animals or even human beings having a change of behavior from the normal. And in fact, the ferrous forms form most of the cases. In fact, if you look at data, almost about 80% of rabies cases are the ferrous forms. And then secondly, we have the paralytic form. And this is one of the forms that most of the time veterinarians or even clinicians may even miss and may confuse it with other ones, because it happens and the animal doesn't show any sign of hyperactivity or hallucinations or probably a change of behavior. All that you see is that an animal will lie down quietly, will not try to bark, will not try to do anything, but probably you go and then pick such an animal, and then the animal will now try to defend itself by biting you or something. Most of the time, the animals that are affected by this form isolate themselves, and then they don't really they isolate themselves and they gradually die out of coma. However, you may have the two forms mixing. So you may have a ferrous form, which will actually gradually end in the paralytic form. Yeah. Now, the question is that how big is this rabies thing that we are talking about? Sometimes we may not see it so big, but in the world, more than 59,000 people every year die out of rabies. In fact, the latest data shows that there are more than about 60,000. And I must say that these are even the reported cases. As we've earlier established that there are so many of these cases that are not being reported. So you can imagine the number of people that are dying every year. So in perspective, we'll say that every 9 minutes, someone is dying out of rabies somewhere in the world. And sometimes we only say that the sad thing is that most of these cases, even in our part of the country, happens to children under the age of 15. And so if you have 40% of these cases being children under the age of 15, it's actually worrying. And one key thing that sometimes we don't talk about is also the number of animals that die. If you are actually been into some parts of the country whereby people depend solely on animals and all that, you can attest the fact that when these animals die, livelihoods of people are taken away and all that. So it actually brings a lot of economic burden on people. Now, we want to look at this how these cases are actually spread across the world. So you can see Africa and Asia being red. And in that, you may see animals like bats, you may see dogs, and all that. So these are the hotspots of rabies. In fact, current trend shows how Asia is doing very well with the control, but Africa is also, we are still lingering. So the latest maps even show that there are some places that they've done much effort in rabies control. So the colors may be a little bit different. However, this whole thing points out to the reservoirs. So someone will ask, why am I seeing bats? Why am I seeing foxes? Why am I seeing other animals here? So all these animals are reservoirs. So in Africa and Asia, yes, so you have the dog mediated rabies, and then you have the bat mediated rabies. However, in countries like North and South America, you have most people getting rabies from the wildlife from bats when they are actually bitten by bats. So because most of these countries have been able to eradicate rabies in their countries. So you don't have the dog mediated. However, you have bat mediated rabies, and then rabies from other wildlife like foxes and raccoons and all that. Very soon we'll have a very in-depth knowledge about the whole thing. Now we ask ourselves, what virus really causes rabies? So just a summary, we will say that the Lassa virus belongs to the family Rhabdoviridae, and the genus is the Lassa virus. For the shape of the virus is a bullet shape. We wonder why it is like that. And then, like we earlier said, it's a neurotropic a virus, and it has affinity for nervous tissue. So when the virus enters into any mammal, it's only targeting the nervous tissues in order to cause the desired problem that it wants to cause. Now we have two forms of the rabies virus. We have the street virus and then the fixed virus. Just for us to have, so the street virus normally is found in saliva of infected animals. And I must say that the virus is always and always present in the saliva of an infected animal. And then most of the time, the incubation period for the street viruses are between 20 and 90 days, but we have extremes. We have extremes. So the street viruses mostly are not used for vaccine production. And then secondly, they also don't produce Negri bodies. But Negri bodies are eosinophilic inclusions that mostly contains the protein particles of the rabies virus. So most of the time, once you see these bodies in the brain smear, is one of the pathognomonic lesions that we actually look for, especially when we are doing rabies diagnosis. Now, the fixed viruses are viruses that have actually been passaged through other or have been cultured, and the infectious pathogenicity has been reduced, and it's actually fixed. And these viruses are not, they don't actually produce Negri bodies. And these are what they use in preparing the rabies vaccines that we use for both animals and then the humans. Now, someone will ask, where does this virus come from and all that? In the natural, we have the virus in a lot of wildlife, like bats, which we know that harbors a lot of viruses, including the filoviruses and all that. So the Lassa virus is also present in the bats. We have other wildlife like the raccoons, the cat family, the foxes, and all that. So these animals ensure that the virus is persistent in the environment. So when animals like our domestic animals like dogs, like cats, or even probably a cow goes close to this wildlife, they actually introduce these viruses to them when they bite them. So assuming a dog goes for hunting and goes and catch probably a bat or a fox or a raccoon that has the virus, in the process, if the animal also bites the dog, it's and if the dog is not protected, automatically it transmits the virus to the dog. And then once it goes into the dog, we all know that dogs are one animals that are very close to man. So from this picture, you can see how close dog is. That is why it's not surprising that 99% of rabies cases are transmitted by dogs, because now even every household owns a dog, and dogs are animals that are within our communities. Now, let me come to the transmission. So someone will ask, how is rabies transmitted? We've established the fact that once the disease the virus is being introduced into an animal, it has a process it goes through, which we'll know in the next couple of slides on the pathogenesis. But I made it clear that the virus is always present in an affected animal. So if an animal bites, scratches, or even licks you, and you have an open or broken skin, you are likely, or you will get the infection. Now, the virus can also pass through the mouth, eyes, especially when it comes to laboratory workers who are not protected. Like we said from the earlier on, the virus is always present in the saliva and the nervous tissues, especially when you work with animals or you're in the laboratory or even a butcher who is probably butchering any animal that is infected with rabies, it's likely you can get an infection through that means. Yeah. Now, rabies is one of the diseases that have a very long incubation period. So, hardly will somebody be able to go and say, okay, I'm going to test for rabies, because one, the virus is able to bypass most of the immune mechanism in the body. And then because there is no serial conversion, you will actually know that the virus is present only when it starts getting into the nervous tissues. And by then, because it progresses, most of the time, it's too late by then. Now, the incubation period naturally will be from 1 month to 3 months, but you have a lot of symptoms that will even happen after a year or even more. In fact, there have been documented cases where people have died out of rabies over 7 years. So that means that you can even be infected and you can still be carrying the virus for more than 1 year. But when clinical signs start showing, that one, you have less than 10 to 14 days to live if it's positive for rabies. Now, there are 3 things that will actually lead to the disease being produced in your body, how fast or how slow the incubation period will be. And these are the 3 things. 1, how close the site of bite is to your brain. 2, how severe the exposure is. So if you have multiple bites, that means that you have less, or the virus have very quick time to probably get into your nerves. So how close it is. So assuming there's a bite on your leg, it will take a longer time for it to get to your brain. And then, or assuming that the bite is actually on a neck, that means that it's very close to the spinal cord. So that means that you'll be able to, the virus will actually move very quickly. So you have cases whereby it will happen within a week or 2, the person may start showing the clinical signs of rabies. And then the third thing is that the amount of virus that is deposited in actually the wound. So like we said, we'll still emphasize that the virus is always in the saliva of the affected animal. The virus is always in the saliva of an affected animal. So if the animal bites you, and how deep it is, or how the amount of saliva that was deposited in the wound will determine the incubation period. Now, I'll use this picture to explain, to explain the pathogenesis of rabies. When a dog or an infected animal, it can be a dog, very soon we'll see how many animals probably can get rabies. So when an animal that has rabies, most of the time, because of the change of behavior, you have animals biting and all that, most of the time, especially when it's the ferrous form. So once the animal introduces the virus into probably your muzzle, the virus stays there for a couple of time and gathers momentum. It accumulates and invades the bite sites, and it reproduces in the nerve fibers of the straightened muzzle at the site of bite. And then it invades nearby. So once it's replicates here in the nerve fibers of the straightened muzzle, most of the time it's multiplies in the spindle receptor of the wound, and then it invades nearby peripheral nerves within the nearby. So now it moves. So once it multiplies in the straightened muscles and moves into the peripheral nerves, like we said, the virus has always affinity for the nerve. So it starts from the peripheral nerves, and then it moves straight into the, once it gets to the peripheral nerves, it's able to also gather momentum, and it moves it tries to, from the peripheral, it moves straight into the axis of the body, that's targeting the spinal cord. Along the axonal plasma of the peripheral nerve, and one key thing is that once it gets to the peripheral nerves, and then it's moving to the spinal cord, it moves at a speed of 3 millimeters per hour. So that is why it's always good to target the virus at the site of bite, because once it gets into the nerves, it becomes almost impossible for you to be able to take care of the virus, because by then it's able to multiply and it's moving very, very fast. Yeah, into the whilst it's targeting the brain. Now the virus ascends. Once it gets to the spinal cord, after moving at a speed of 3 millimeters per hour, and at arriving at the dorsal root of the ganglion, the virus multiplies in it. So it tries to get to the dorsal root of the spinal cord ganglion, and then it multiplies there. Once it multiplies there, then it moves into the spinal cord itself. Once it invades the spinal cord, there is virtually nothing that anyone can do, and then it ascends gradually and goes into the brain, and that is where most of the clinical signs start showing, which we'll see very soon. Once it gets to the brain, it's not done. Let's see what happens. So I think we've talked about this. Just to emphasize something, that from the local wound to the peripheral nerves, it can take about 3 days up to 2 weeks, depending. It all depends on the factors we've already mentioned. 1, the closeness of the site to the brain. 2, how deep the wound is. And then 3, the amount of virus that was deposited into the wound. We've also talked about this one. So in the central nervous system, one characteristic of the virus is that it binds to the postsynaptic narcotic acetylcholine receptors. And once it binds to these receptors, communication is actually bridged between between the neurons and all that. So hence the various signs that we see in a rabid animal. The virus then, now once it has ascended into the the central nervous system, it has gotten into the brain, it's multiplying. What the virus does is that now it starts invading tissues. And you will see very soon what this whole thing, what happens to once it invades into the tissues, especially the salivary nucleus. We all know that the salivary nucleus is actually a parasympathetic fibers that stimulate it actually ensures secretion of saliva. So once it invades this bundle of nerves, there will be uncontrolled saliva secretion. It also targets the glossopharyngeal nucleus, which is also one of the nerves that ensures sensory, and then it actually controls motor and then sensory fibers. And then the hypoglossal nucleus is also targeted, which we all know that it also helps to control. Helps to control muscles of the tongue, and it also helps you to swallow. And then also the tongue also helps you to speak very well. So once these nerves are compromised, you see all these nervous signs that we'll be talking about in the next minute. Yeah. Now, someone also asks, what are the clinical signs of rabies? One key thing about rabies is that there is always a sudden change of behavior. So from the first picture, you can see a very calm dog. In the next minute, once the virus starts replicating in the brain and other nervous tissues, as we've learned from the pathogenesis, there is sudden change of behavior. So a very calm dog now becomes very aggressive, and now he starts moving towards inanimate objects because of the hallucinations and the hyperactivity and all that. And then once it changes behavior, in fact, we have cases whereby a dog which knows someone very well will now start biting you. So now you have reports of these dogs biting other people, biting other dogs, biting any other animal because of what is happening. And then, like I mentioned, the paralytic form, you may have a very aggressive animal now becoming very calm. So there are two ways of affairs, and that is what most people even confuse with other diseases, because the animal may not show any sign of aggression, but will sudden change behavior. So anytime we have a sudden change of behavior of our animals, we should be, rabies is one of the differentials that we should keep in mind, especially when the animals start biting other people and die within a period of say 10 to 14 days, or even die earlier. We should be very suspicious, and we should be able to find the cause of the disease. The other thing we've talked over, and I'll still emphasize, is that there is an aggression. And this is because of the emotional control center of the brain, mostly we've talked about, that is being affected. And there's hydrophobia because, one, we've seen that the cranial nerve that controls muscles of the tongue and other things are affected. So the human being or the animal is unable to eat. And then because of that, there is painful contraction of the diaphragm and then other respiratory muscles. In fact, because of this actually leads to the coma, because the animal is not able to breathe well, or is not able to actually eat and all that. And then because of the pain associated with swallowing, the human being or the animal may not even want to even eat or swallow anything. There is hypersalivation. We've talked about the cranial nerves that are being affected. And then due to that, you have animals which have rabies with, we term it drooling, excessive saliva coming from their mouth and all that. So we talked about our abnormal behavior, attacking objects and all that. I don't want to still bore you so much, but the key thing is that, one, there is change of behavior. Two, you have all the nervous signs inability of the animal to swallow, inability of the animal to eat, animal becoming paralyzed. So you have all the nervous signs that we can talk about. In fact, you have some animals even having incoordination. They are not able to walk. They are not able to they are not able to bark. So most clients will tell you that my animals have been barking throughout the whole night with a lot of pain. So because the larynx and other nerves are all compromised, the animal tries to howl. It tries to bark, but the sound doesn't really come. So the animals may make noise throughout the whole night. And in fact, when this thing happens, the animal has less than a day or two to survive. So I just want to, by means of just teaching purposes, I want to show some few things that normally will happen when animals get rabies. So this is actually the dog that was presented in our clinic some time back. Somebody picked this dog from a neighbor, and he actually brought it early morning. And we're trying to, from history, we realized that the animal has been like this for the past 24 hours. And we from interrogation, this animal was not vaccinated. So we really wanted to really examine some few things. And rabies was one of the things we were suspecting, because it was showing all the classical signs of rabies. So you can see the paddling. You can see that the animal is not comfortable when you push, when you are pushing the box, because of the pain and because of the whole nervous signs that is actually going. So then the animal goes through pain, is not able to withstand even the sound of air and all that. So these are what animals also go through. This is also one client that also. So the owner told us that the animal is not able to bark, is not able to, is making noise throughout the whole night. And it's surprising that some people will attribute this to probably people poisoning them or people beating them and all that. But from investigation, we realized that this same animal too was not vaccinated for some time. So we're trying to really look at some few things that the animal will actually show, especially when we have rabies in mind. So this animal is unable to walk, a very active animal. And you will see in the next few minutes what will happen to the animal, probably at the site of introduction, because most of the time, the sites where the virus is being introduced, there is a little bit of pain and tingling sounds and all that. So it's possible that probably the animal that introduced the virus to this animal probably bit the tire or something, because the animal is actually showing a lot of pain when we started touching the tire and all that. And you can see from the picture how most of the time the animals are not able to, the tongue become paralyzed. So the tongue doesn't go back. The mouth is always open, and because of that, the animal try to drool. We'll see one video in the next sorry. Okay. Let me go to the next video. So you can see from this animal that this animal is also unable to walk. You can see how the animal is actually struggling to probably swallow the saliva. You can see the amount of saliva. That is why we can say with confidence that a scratch even from a rabid animal can get you, you can get rabies from it, because most of the time, animals like this, you can see how the saliva is drooling on the body. So most of the time, you have the pores and all these things being contaminated with the saliva. So that is why, as healthcare practitioners, we should not always look out for a bite. When a person is being exposed to an animal like this, when it's exposed to an animal like this, there's a possibility that a person can get it, not only through a bite, but even through a lick from an infected animal. Now, there are a lot of differentials. So we have had a lot of cases whereby people even try to show nervous or nervous signs and other things that we try to relate it to rabies. However, we should always know that rabies cannot happen in a vacuum. So therefore, we should have, especially when there is no bite, especially when there is no bite from an animal or we've not been able to establish it from the infected animal. We should look out for other differentials that may confuse us with rabies. So you may have these like tetanus, cerebral malaria, rickettsia disease, and all that, and all the paralytic infections that we have. In fact, I think Dr. Comey will throw more light on some of these things. So we have a lot of disease that we can look at, especially when the person has not been bitten by any animal or there's no history of bites. We should look out for other differentials as well. Now, the question is that what animals get rabies? I know that probably if we had the opportunity, most people would tell me that it's only dogs and cats. But we have monkeys, every mammal. So we have rabies in cattle, we have rabies in pigs, we have rabies in horses. Every mammal can get rabies. Once it's bitten by an animal, an infected animal, it can get rabies. However, domestic dogs are the main reservoirs for human rabies in Africa and Asia, as we've mentioned. So that is why the emphasis most of the time is on dog-mediated rabies, or the emphasis is on we eradicating rabies by vaccinating our dogs, because 99% of all the rabies cases are being transmitted by dogs. Now, I want to make a point here that doesn't mean that you may not have goats and other things transmitting rabies. However, most of these animals are termed the dead end host, meaning that they typically pass on the virus to either one or two people. Even human beings, they pass on the disease to the immediate people when probably they actually dying, because most of the time you may not have goats moving in our streets or even cattle moving in our street trying to bite people like how dogs do. So most of these animals get it, but most of the time they get the paralytic form, which they can transmit or pass on to or infect people which are very close by before they actually die off. So that is why the emphasis is mostly on dogs. Now, a lot of people will ask questions about how is rabies being diagnosed. I just brought these three very tests that we actually do, and these are tests that most of the time we have them in our country here, or we actually do in most of our labs in our country. So the gold standard is what we call the fluorescent antibody test, which is one of the key tests that you can do to confirm rabies. So it's mostly done by having a brain smear, and then it goes through a process, and then now you view it under a microscope. So it's one of the gold standards that we have for rabies diagnosis. And then we also have the PCR. Because of COVID now, a lot of people are familiar with the molecular test, the PCR. So we do real-time PCR, and we use the brain or the saliva or even the CSF fluid for molecular tests. And the antigen tests, we have test kits that we are able to also use on the field to diagnose rabies. And it's mostly the first thing that most of the time we do on the field for us to have informed decisions before we even go ahead to do the confirmatory test in the lab, either using the PCR or the FAT. Now, this is just to show how the field diagnosis is done. So most of the time, the brain is actually taken off. In fact, the only organ that we need for the show organ is mostly the brain. So we try to take the brain, and so we have a technique that we are able to get a sample of the brain on the field to be able to do the antigen test. And you can see from the picture that this dog, for example, was positive. So you can see the two lines here. You can see the two lines, the control and then the test. Now, the preventive measures. We'll still probably talk a little bit about it when we get to the IBCM. However, let me just touch on this briefly. So we have when there is no bite, when there is no scratch, or when there is no lick, there is no rabies. So meaning that you cannot get rabies through the air. There has to be a contact. Even if it's a lick, there should be a broken skin before the virus can enter. And it's possible for an animal with rabies to spread the sickness to another person, before it shows clinical signs. In fact, we will still continue to say that it's one of the viral diseases that has a very long incubation period. Over a year, somebody can be incubating for rabies, and that makes it very scary for us, especially when the appropriate measures are not taken when you are being bitten by a dog, which we'll be looking at it. Dr. Komi will talk about it very soon. So what we want to say is that as healthcare professionals, we need to encourage, we need to dedicate our clients that one, we should stay away from dogs or any other animal, especially when the animal is showing any unusual sign. Don't go and be picking animals from the gutters and all that. Even if you are doing that, you should ensure that you are maximally protected. Dogs may bite when they are surprised. Yes. So what we always tell people is that most of the time we have dog bite cases when dogs are not being provoked. Sometimes people may enter a house and then they may not knock. But once a dog is there, the fact that it bites doesn't mean that it's rabid. But every dog or every animal will try to attack you when you surprise it. So we are saying that take your time when you are passing or entering a place where dog lives. Avoid touching or getting close to stray dogs. In fact, it's always good that you stay away from stray animals or dogs that you are not or animals that you are not comfortable with. We have had cases whereby children will now go and put their hands in dog's mouth, trying to take a bone from a dog and all that. So these are all advice that we need to give to our clients, that we should stay away from animals that are acting strangely, and then we should stay away when animals are being eaten and all that. Now, what to do when you are being attacked? As healthcare workers, sometimes you may have healthcare workers like community health nurses going to people's home to probably go and then do the routine vaccinations. You may have a dog that probably will chase you, and these are some of the precautions that we always want to do. In fact, if you are being chased by a dog, one of the key things that you have to know is that immediately you run, the dog will chase you. So it will be good, or the first precaution is that you have to stand still, avoid eye contact with the dog. Make sure that you put your hands beside you, because the dog will always try to grasp something when it's biting. So you should always put your hand beside you and avoid eye contact. Once you do that, the animal will actually not sense a lot of danger. It takes away a lot of fear, or it makes the animal feel that there's no fear around. But if you run, it will try and it will chase you, especially with children. It will try and chase you. So it's always good to stand there with your hands still and avoid eye contact. That's the most important thing. Once you avoid eye contact, the animal will come and sniff by you and then will go away. But if you scream, that is when the animal will also pounce on you and will bite you. So if you can, just keep quiet, avoid eye contact, put your hands by you, and assume a tree position, and the animal will come and sniff and move away. However, we have animals that no matter what you do, you stand still and will still want to bite you. When an animal does that, what you have to do is that you need to protect your vital organs. One, you need to protect your face, like we said. When an animal bites your face and is rabid, for example, the incubation period can be less than even a week or two. So make sure that you protect your vital organs. So you assume a position of a rock, like how these girls have bowed down, and then they've covered their face. When you do that, you are able to protect vital organs, so the wound will not be severe as you are standing. So it's also something, these are all precautions we want to know so that in case we are being attacked, we can be able to protect ourselves, because we've established the fact that we can only get rabies when we are being bitten by an infected dog. And apart from it, we also know that it's not only, apart from you getting rabies, there are other ones. If the bite is very deep, it also influences the incubation period and all that. So these are all things that we can also do to avoid dog bites. So the other thing that we still will emphasize is that we should not be screaming when somebody is being attacked. Assuming you are working with a child and the dog is coming to you, don't make noise, because this may attract the dog. Assuming you are in a group and then the dog comes and attack you and then you scream. Immediately you scream, that particular dog will leave that particular victim and move to the person that is screaming. And then we should also avoid throwing sharp objects to the animals when we are being attacked, because you end up even causing more harm to the person that is being attacked. Rather, we want to say that you want to distract the attention of the dog by throwing something else. It could be a bag, a shoe, or a branch of tree. You throw it at some place. So once you do that, you distract the attention of the animal to that point, and then securely you can protect that particular child or yourself. Yeah, so tips to dog bites, we've talked about it. We'll still don't disturb dogs, especially when they are sleeping. We should stay away from stray animals, stray dogs. Don't enter into a jurisdiction where dogs are as much as possible. These are some of the few things I would want to say. Now, these are pictures. So it's always good also to know, it's always good to also know the behavior of dogs when a dog is threatened, when a dog is anxious, and all that. For example, when a dog is threatened, it will actually put the tail in between the legs. And such a dog, if you move your hand by it, the dog will actually bite you. That doesn't mean that the dog is rabid, but the dog is actually threatened. And once it's threatened, it will bite. Yeah, I want to just make these points, or just to show this picture to emphasize something. So this is actually a picture of a dog, a person that has been bitten by a dog. So you can see this wound. So when somebody has this wound, it's more than of an emergency, and Dr. Comey will talk to it when we are doing the management. And then if a dog probably bites the leg too, it also informs the incubation period. However, because the virus is in the saliva and we've established the 3 facts that it depends on the amount of virus that is deposited, we want to always ensure that we don't bandage dog bite wounds as much as possible, because if we bandage it, and in fact, if it's especially when the wound is not washed, you are helping pushing the virus close to the nerve, and that will inform how fast the virus will multiply and target your peripheral nerves. So as much as possible, we want to leave a dog bite open. I think that Dr. Comey will talk about it. I don't want to talk more on that. So these are some few pictures that we want to show, and we want to also use this to advise our patients and all that. That one, we shouldn't allow children, especially, to share a bowl with dogs, because such a process can lead to a dog biting your child or something. So somebody will ask, is this picture real? Yes, we've seen cases where pet owners have put their hands into dog mouth just to they feel that the dog has swallowed something. You know, we talked about the inability of the dog to swallow. So I personally have had a case where a person is putting the hand into the dog mouth, thinking that something has dislodged the throat of the dog, and the dog was actually positive for rabies. So you can imagine how some of these things can be. So when a dog is probably feeling uneasy to swallow or even to eat, it's always good with this knowledge in mind. You should always try and get a health and an animal health professional to look at the animal for you. Okay, so we've established that 99% of all dog bites, human-mediated rabies are actually transmitted by dogs. So what we are saying is that if we're able to vaccinate our dogs and our cats against rabies every year, in Ghana, we do rabies vaccination for our pets every year. If you're able to do that, that means that we are breaking the transmission cycle. And then we are also protecting families and then the public as a whole. We want to continue to emphasize that vaccination in dogs or in animals is very cheap than we vaccinating our human beings. That is why we encourage everyone to vaccinate his dog, to ensure that for us to be able to control rabies effectively. In fact, dog vaccination should be one of the key things. However, vaccination, we've emphasized that it is a two-way, dog vaccination or animal vaccination, and then getting the post-exposure vaccines, the human post-exposure vaccines timely is also a key thing, especially when we have not been able to eradicate rabies in our country or in this part of our world. It's also one key thing that we have to keep in mind. Yeah, so this is just a picture. I know that most of us know about herd immunity. So this is just something to show us that indeed, when we vaccinate our dogs, herd immunity is able to protect us is able to protect the animal population from transmitting these dogs to other animals, and hence transmitting it to human beings. So if these whole animals are not being vaccinated, if an animal that is vaccinated, if an animal that is rabies come and bites, it transmits the rabies to them. So very soon, in a matter of 3-4 months, all these animals will come down. However, if these animals in blue, for example, if an animal enters a community, and then the blue ones represent the vaccinated ones, the black ones represent unvaccinated ones. If an animal that is rabid in red comes in and even bites the black one that is not vaccinated, because the blue ones are vaccinated, they are protected. They protect, even if they bite the vaccinated ones, they will not come down with rabies, and hence they will not be able to transmit it to other dogs. And these are things that we've testified in our vaccination sites. Now, we want to also say that there should be an effective legal basis for our control should be established. And most of the time we have bylaws which guard our keeping of animals in our homes and all that. And one thing that we've seen is about we enforcing the law. That is why a dedication is key. Once we care workers know about how fatal this disease is, we can also advise our patients or our clients to be able to ensure that we vaccinate our animals. And also there is a collaborative effect. That's the One Health approach. In fact, for us to be able to deal with rabies effectively, the One Health approach is very key. And this is one of the steps we are taking tonight to ensure that the animal health and the human health and all the other agencies come into place, so that together we can all ensure that our various roles that we have to do, we actually do those roles to ensure that we are able to control the rabies effectively. The last thing I want to say is once we're able to control the population of dogs, so if you are not able to, in fact, it's very expensive to keep dogs. So what we are saying is that don't keep more dogs than you can you can manage. So these are the advice that we give to pet owners. The maximum dogs that you can keep, maybe 1 or 2, unless you are doing breeding and unless you have you have the capacity to be able to ensure that you take very good care of them, especially when it comes to their vaccines and other things that you have to do for the dog. Yeah, so we have to also promote responsible pet ownership. This is something that we all have to also do in our education to our clients. And then we'll also continue to remind ourselves that rabies vaccination is done every year. It's done every year. So thank you so much. I think I'll end my presentation here, and then I'll allow our moderator to take over. Thank you. Thank you.
Thank you so much, Dr. Peku. It's been quite an insightful presentation. We don't want to waste any time, so we would take the human health management of animal bite cases. So Dr. Oliver Komi would take over from Dr. Peku now. Thank you.
Good afternoon, everybody, or is it still, it's good evening, everybody. I'll be sharing my screens very soon. And I want to say a big thank you to Dr. Peku. Dr. Peku, please, can you stop sharing so that I can share my screen? Dr. Peku, for the insight he's given to us. At least one thing or two things I learned from his presentation was that when you are being attacked by a dog, you should behave like you are a tree. That is a little...
Komi, sorry to interrupt you. We would like to acknowledge the presence of the president as well as the vice president of the Ghana Medical Association. So we have Dr. Med Frank Cerebral and then Professor Dr. Med Ernest York. So thank you for joining us. Please, you may proceed.
Okay, thank you very much and welcome our able professors. Just a minute. Share. So like I was saying earlier on, I learned that when you are attacked by a dog, you should sometimes behave like a tree, or you should curl up like a rock. So remember, either you curl up as a rock or you stand as a tree. So good afternoon or good evening once again. I want to continue from where he left off. Yes, we're talking about diagnosis. I must say that it's very difficult to diagnose rabies before the onset of the clinical disease. So one of the key things is that there should be a suspicion which should be based on the history of contact with a confirmed or suspected rabid animal. The recognition of an exposure is the very key thing that we need. And I want to say that human rabies usually is almost confirmed on post-mortem basis. So he spoke about this earlier on, that several factors affect the risk and progression of the disease. First, we talk about the viral inoculum. Then we look at the location of the bites. This is just rehashing that bites that are closer to the brain or closer to the face or closer to the spinal cord tend to have a rapid progression or a shorter incubation period as compared to bites that are coming or that occur at the extremities. And then the prominent salivary inoculum. So if I have a single bite as compared to multiple bites, once I have multiple bites, more inoculum from saliva, and then I may or tend to have a shorter incubation period and more aggressive disease. Human rabies infections, we said, are divided into two He spoke about the furious or encephalitic form and then the paralytic forms. This is just to guide us through the rabies stages. So yes, there's an incubation period, and we learned earlier on that the incubation period may be between 20 to 90 days, but then there's documentation of going up to about a year in some cases of people who had incubated rabies for that long. Following the incubation period, you may have a prodrome period with the early symptoms that we shall look at. Then we have the acute neurologic disease. If you remember the signs and symptoms in the dog, they are similar to the signs and symptoms also in the adult or in man. Then we progress to coma, eventually death. So what happens during this prodrome? So it typically lasts about 4 days. Some books say it may go up to about a week. The key thing is that the initial symptoms of rabies resemble those of other systemic viral illnesses. So you have a fever, you have a headache, you may have malaise, but you may have disorders of the upper respiratory tract and GIT. But here, think about the fact that you have changes, subtle changes in your personality and cognition. And he made mention of one thing earlier on, that there may be paresthesia or pain near the exposure site. That's where you were bitten. And once you have this, you should be thinking about suggestive of rabies. The acute neurological condition. So we are looking at the encephalitic rabies or the furious rabies. Usually they may present with a fever, like we spoke about, hallucinations, and a bizarre behavior. Then we spoke about the hydrophobic spasms or swallowing of the swallowing muscles, which will lead the patient sometimes also drooling or excess salivation. You may have a person, sometimes the person becomes aggressive. Then there are periods when the person is lucid, is talking to you, and then you have those periods again of excitement, agitation, before they may progress also onto the coma stage. Remember, we also spoke about the fact that there's dysarthria, dysphagia, diplopia. These are all symptoms of cerebral nervous system disease. For the paralytic rabies, which he spoke about earlier on, in man, it tends to be more, it resembles an ascending paralysis. So one of the differentials we may think about is a Guillain-Barré syndrome. Or another thing you may see here is that there may be weakness, which is more severe in the extremity where the inoculum or the virus was introduced. Paralytic rabies, we know, affect the spinal cord with severe inflammation or the segmental demyelination in paralytic rabies. Like I said, it's usually just about 20% of the cases that will present with this. Then these patients may become silent, progress into coma, and obviously after coma, the next thing is the respiratory muscles will go into the spasms, and then these patients usually will die. Look at when the patient first presented to when the patients die, usually within 2 to 14 days, or within a week or two, these patients are dead. I will go on to show some pictures or some videos of rabies that we've seen in humans so that you understand. And there are some pictures I got from the fevers unit. I thank them for giving me those videos, and they shot them for teaching purposes, and we had explained to the family members why we were doing that. So please don't be too alarmed when you see this. These are just for teaching purposes. So this is from Nigeria, and I just want you to look at this patient. So this is a patient with rabies. This definitely furious rabies. And this is a patient this is clinical rabies. So that is one picture you are seeing. This is another video demonstrating the difficulty in swallowing. The next video also demonstrates a similar thing. There's one thing I want us to learn from this video. Remember, we said that the rabies virus is present in saliva. As healthcare workers, do not do these things without personal protective equipment. Please make sure your hands are well protected, or you are well protected before you come into the contact with saliva of these rabies patients. These two are what we did at the fevers unit, okay? So the patient is restrained, and here bringing just water, the sight of water. Here, we asking the young boy to come for water. He should just come for water. Just the sight of water. So this is what clinical rabies looks like. For the first patient we had, who's on admission, and there's a young boy who has been brought in. Just the sight of water, and he's just running away from water. We lost both patients. So, like we spoke about earlier on, the differential diagnosis when you are thinking about rabies is that in earlier things, think about other infectious diseases. We spoke about tetanus, cerebral malaria, both the rickettsial diseases and typhoid. And for the paralytic rabies, we said you should think about Guillain-Barré, also think about botulinum poisoning. Okay. How do we prevent human rabies? The key thing is to avoid the bites. Then we'll talk about pre-exposure prophylaxis, post-exposure prophylaxis, and post-treatment after somebody has had a bite. So the first thing, there are two types of exposure. There's a bite and a non-bite. So the bite is any penetration of the skin by teeth constitutes a bite exposure. Any penetration of the skin by teeth constitutes a bite exposure. And for the non-bite, we see it as a contamination of one open wounds, abrasions, mucous membranes, or scratches. These ones constitute a non-bite exposure. So we have two types of exposures, a bite exposure and a non-bite exposure. Having said that, we need to categorize our exposures, okay? So we have category 1 exposures, category 2 exposures, and category 3 exposures. When you are touching or feeding an animal and the animal licks an intact skin, we do not say that any exposure has taken place. And that's a category 1 exposure. You understand that depending on the type of exposure, there is a particular regimen of post-exposure prophylaxis that we have to put in place. So knowing first that we have a category 1 exposure, a category 2 exposure, or a category 3 exposure is critical in deciding on post-exposure prophylaxis. Category 2 exposures, nibbling of the uncovered skin, minor scratches, abrasions without bites, or without bleeding, are considered category 2 exposures. And for 3, either a single or multiple transdermal bites or scratches, contamination of mucous membranes or broken skin with saliva from animal licks, exposures due to direct involvement with bats. These are all considered category 3 and severe exposures. So why do we need to know about these exposures? So for category 1 exposure, it is not regarded as one that you need to provide post-exposure prophylaxis. So no post-exposure prophylaxis is provided for category 1 exposures. For category 2 exposures, post-exposure prophylaxis by vaccination should be instituted as soon as possible. Category 2, we are talking about post-exposure prophylaxis by vaccination. For category 3 exposures, here, you still do the vaccination, and then you will infiltrate the rabies immunoglobulin if indicated. For category 3 exposures, 1, vaccine plus the rabies immunoglobulin if indicated around the wound. Okay, let's go on. So what does post-exposure prophylaxis entail when we talk about rabies management? Post-exposure prophylaxis is not only giving vaccines. Post-exposure prophylaxis involves wound management, immunization with a course of potent and effective rabies vaccine, that means WHO standards, and then the administration of immunoglobulins when that is also indicated. So if you are asked about post-exposure prophylaxis in rabies, it's 1, wound management, 2, rabies immunization, and 3, when we have to give the rabies immunoglobulin, we give it. Post-exposure prophylaxis is not only administration of the rabies vaccine. Wound management is key, vaccination is key, and for category 3 exposures, you add on with your rabies immunoglobulin. I hope that is very, very clear. So guide to PEP. There are no contraindications to post-exposure prophylaxis. Pregnancy, infancy are not contraindications to post-exposure prophylaxis. It must be said that if the rabies immunoglobulin is not available on the first visit, which most of the time is the case, its use can be delayed for about 7 days from the date of the first vaccine dose. Please initiate PEP as soon as possible. Do not await or wait for the lab results, or it should be delayed when because you are observing the dog to see whether this dog has rabies or not. You go ahead, start the vaccination. Once we confirm that this dog hasn't got rabies, we can stop the vaccination in humans. The last thing I want to say is that patients presenting for rabies PEP, even months after having been bitten, should be treated as if the contact had recently occurred. Patients presenting for rabies PEP, even months after having been bitten, should be treated as if the contact had recently occurred. So we say that PEP should be administered even if the suspect animal is not available for testing or for observation. And here we spoke about the fact that the vaccines, or you give the immunoglobulins and vaccines, they can be discontinued if after the period of observation, we realize that this dog is not rabid after all. And the confirmation must be from a WHO prescribed laboratory. It is not just by an owner saying that my dog is not rabid after all. Okay, so what do we do with the wound management? Immediate flushing or washing and flushing for the wound for about 15 minutes with soap and water, or sometimes with water only. Then you can use disinfection with detergents, 70% ethanol, iodine tincture, so any substance with a virucidal activity. Bleeding at any wound site indicates potential severe exposure and must be infiltrated with either human or equine rabies immunoglobulin. Wound healing in rabies is by secondary intention. Please do not suture big wounds if you don't need to suture them. Please do not suture the wounds. Let them heal by secondary intention. Then remember also that once a dog has bitten somebody, there may be some death. So think about giving your antibiotics and also giving your tetanus prophylaxis in cases like that. The wound management we spoke about earlier on, that in administering the rabies immunoglobulin, make sure you infiltrate the immunoglobulin into the wound and around the wound. At least about 70 to 80% should be within the wound or around the wound. And then the rest can be given as an intramuscular injection at a distant site from that of the vaccination inoculation. Please don't give the if you are giving the vaccine on the right side of the deltoid or the right deltoid, please do not give the immunoglobulin on the same site. Immunoglobulin and vaccine are given at different sites, not at the same site. Okay, so the route of administration of the vaccine, it's either intramuscular or intradermal. Vaccines should be injected into the deltoid muscle for adults and children 2 years and above. So anybody above the age of 2 should have the rabies vaccination in the deltoid muscle. For younger children, it is the anterolateral thigh that is recommended. People, colleagues, friends, people who are listening, if you are a patient or if you are a non-health person and you are listening, do not allow the vaccine to be injected into your gluteus. Some people go into the hospital and say, me, I can't take injections in my upper torso. I want it in my buttocks. Please, health workers, do not give the rabies vaccine in the gluteus muscle. I hope that is clear. So how do we treat category 2 exposures? Now that we have said that we are going to give post-exposure prophylaxis. So there are some schedules that have been given. The first one we'll look at is the patient who has not been immunized before. So if the patient has not been immunized before, you can either give, so on 2 different sites, intradermally, day 0, day 3, and then day 7, intradermally. Intradermally, that's on 2 sites. Or if you are doing IM, if you are using the IM route as 1 site, on day 0, day 3, day 7, and then between days 14 and 21. So you can either do day 14, you can either do day 21 or day 28. So if you are using the IM route, you are looking at 4 vaccines or 4 schedules. If you are looking at using the intradermal route, it's 2 sites on day 0, day 3, and day 7. If the patient has been immunized previously, so I'm sure we'll get to the point where we talk about somebody who has had pre-exposure prophylaxis, or the patient maybe had some rabies immunization some time ago. In that case, and the person is bitten by a dog again, in that case, it's 1 site ID, intradermal, on day 0 and day 3. When the person hasn't had any immunization before, it's 2 sites intradermal, day 0, day 3, day 7. If the person has been immunized previously, it is 1 site intradermal, day 0 and day 3. And if it's IM, it's still 1 site, day 0 and day 3. I hope that has been assimilated. For category 3 exposures, same as category 2. However, in that case, you are going to add on the rabies immunoglobulin. For the person who has not been immunized before, add on, apart from vaccinating, you add on the rabies immunoglobulin. For the person who has previously been immunized, even with a category 3 exposure, you do not give the rabies immunoglobulin again. I want to repeat this. For category 3 exposure, for somebody who has not been immunized before, you, apart from vaccinating, you want to add on the rabies immunoglobulin around the wound. For somebody who has had previous immunization, you still want to give the post-exposure prophylaxis, but in this case, you will not add on the rabies immunoglobulin. So it's important that you categorize your exposure and you know what you are doing. And so this is just this just shows that first there's a dog bite after the virus has been inoculated. So category 1, no vaccine. Category 2, there's a vaccine. And for category 3, non-immunized, there's a vaccine and the rabies immunoglobulin. So this is a guide to the post-exposure prophylaxis ID route. We say that the intradermal regimen requires reduced volume of vaccine to be utilized than the IM routes. Whereby, so if you use the intradermal route, you can reduce the volume or cost of the vaccine to close to about 60 to 80%. So it's recommended for a resource poor setting like Ghana or like the resource poor settings. And the volume per intradermal route is just 0.1 ml. The key thing here is that they should be trained to give the vaccine intradermally. And once you give intradermal, we are expecting to see a visible and palpable bleb in the skin. If you give intradermal and we do not see any raised bleb, you have just wasted the vaccine. You cannot call that an intradermal, and you also cannot call it intramuscular. So where have you put the vaccine? You have just wasted the vaccine. So I must say that once we are dealing with intradermal, make sure that there's a visible and a palpable bleb in your skin. Pre-exposure prophylaxis. So pre-exposure prophylaxis is recommended for anyone who is at a continual, frequent, or increased risk for exposure to the rabies virus as a result of their occupation or their residence. So let's say that infectious disease nurses, infectious disease practitioners, there are colleagues who work in the vet, anybody who is breeding dogs, anybody who has a lot of dogs in their house. These are people who should have pre-exposure prophylaxis. And this is a 2-dose pre-exposure prophylaxis, which is given on day 0 and day 7. Okay. I'm sure in the next few slides, I'll just go through some job aids that we have on integrated bite case management. And once I'm done, Dr. Peku will take us through the details of this. So this is just, and these are posters that I'm sure we have seen some of them around. So that if you should get a dog bite, immediately wash the wound with soap and the running water continuously for at least 15 minutes. It will be good for us to have these posters in our facilities. Clean the wound with saline solution, hydrogen peroxide. Do not bandage or stitch the wound unless it's absolutely necessary. Ask clients questions to assess the circumstances of the bite and then the level of risk for rabies infection. If a child went to climb somebody's mango tree and fell down in the house and landed in front of the dog, and the dog bit that dog, that child, that wasn't an unprovoked bite. You found yourself at the wrong place. And we also know that for rabies, we are really looking at unprovoked bites. And then there are some case-based forms that we have to fill in our facilities when we have a rabies. And this is used in the surveillance so that we can see whether we are doing well with rabies management in this country. Then you must refer the patient also to the veterinary officer. Remember, we are talking about One Health. We are talking about One Health. So yes, the link between animal, environment, and human health. And also share any valuable information about the dog bite with the veterinary officer. Provide the client a post-exposure rabies vaccination and remind the client that they must receive all the doses of the vaccine to be fully protected. Don't start and then midway you stop. You must complete the schedule. Educate the client on the risk of dog bites and the steps to rabies prevention. And then we must document whatever we have done in an IDSR report. So this is just a summary. By way of summary, we'll say that rabies is a vaccine preventable viral infection, has a variable incubation period. It could be short, it could be as long as 90 days, and may stretch sometimes up to a year. Clinical rabies is fatal. Pre-exposure prophylaxis and post-exposure prophylaxis, very important in the prevention of clinical rabies. The key to PEP is the management of the wound. And I must add here that there are different vaccines on the market, different vaccines in country, and the manufacturers always give the schedule, and please follow the schedule as prescribed by the manufacturers. WHO recommends 4 vaccine schedules that we also need to know, and the best method of prevention is avoiding the bites. So thank you for your attention, and I'm sure after the next lecture, we shall be ready to take your comments. Thank you very much.
Okay, we want to say thank you to Dr. J. Oliver Comey for taking us through the management of human dog bite cases. So we want to take the very last presentation quickly so that we can get to the questions and then the answers. Please, those who have questions to ask, you can go to the Q&A comment section and then type your questions there. Thank you. So can we have Dr. Peku coming to give us the last presentation? Thank you.
Okay, thank you so much, Dr. Asari, and still all protocols observed. We want to still continue with where Dr. Comey ended. Thank you so much, Dr. Comey, for that insightful case management presentation. So I want to begin this presentation with a very with a story, very brief. This is something that happened some let's say about 3 months or 4 months ago. So I was there in the clinic where a woman came with a boy at the back and was complaining of dog bites. A dog had bitten the child, and but the woman was crying, so I had to sit her down, ask her questions, and then now we had to start the investigation by calling the owner. And then after calling the owner, what happened was that the owner said, yes, the dog bit the woman, but we've killed the dog and we've buried the dog. Now, the question is that what do we do? So I tried to explain to the owner that yes, if I've per the WHO protocol, the dog is not found, then that means that the victim has to take the whole doses of the post-exposure, just as Dr. Comey has earlier said. So after further investigation, the owner now owned up and said, yes, we've killed the dog, but the dog is buried in the house. So we went and exhumed the carcass. And then because of the molecular technique, the PCR, we tested, and fortunately, unfortunately, it was positive. And what happened was that it was not just the woman's son that the dog bit, but meanwhile, the dog bit himself, and then the other, even I think about 2 of his children. So the issue is that if we had not probably followed up or done this investigation, probably the other contact, which included a man, would have probably come down with rabies after some few weeks. That is why this is very critical whenever we are managing rabies cases. So always, we don't have to always look at just the patient or the individual person that has reported, but there's a need to do other assessment. And that is what the IBCM is all about. That's the integrated bite case management. Sorry. Okay. So animal bite surveillance. So the One Health system requires reporting of bite cases from hospitals, health centers, to veterinary clinics, veterinary officers, professionals, and vice versa in our district. So basically our facilities. So it's a One Health approach that seems to harmonize the human health, animal health, and even environmental health, because all these stakeholders play a vital role when it comes to disease surveillance, especially when we are dealing with a zoonotic disease like rabies. Now, what's IBCM all about? So it's just an approach for rabies surveillance that directly or formally links the human health professionals to veterinary professionals to assess the risks of rabies among animal bite patients and the animals as a whole. So it's not just assessing the animals, but we also look for other contacts. And that is what IBCM is all about. And in fact, when we are able to do this system effectively, it's able to promote the increase it's able to help us to detect more cases. Like I said in the short story that I mentioned, if we are not followed up to the community to go and then do an investigation, probably we may not have other contacts. And fortunately, all these contacts were referred to Kolebu to go and take the post-exposure prophylaxis. It also improved the administration, the cost effectiveness of the PEP. Like Dr. Comey said, yes, once rabies has not been eradicated in our country, every dog bite is a suspected rabies case until it's proven otherwise. Otherwise means that we investigate, and after a period, we either discontinue the post-exposure prophylaxis vaccine or we continue. And it's also as a potential surveillance strategy for verifying freedom from rabies. Yes, so if we're able to do it very effectively, we are able to tell that probably the dog's bite, it's not every dog bite case that is a potential rabies case or ends in becoming a rabies case. So it will help us to take up all these cases, and then at the end of the day, it will also help us to know that whether we are free from rabies, even if we are having dog bites. Now, the clinical signs of rabies, I want to just give this acronym ALPHA. And this ALPHA actually depicts everything that happens in a rabid animal or even a human being, because always there is aggression without provocation. So like I said, when we are doing the surveillance, what we ask, the first question that we ask, did the animal bite you? Was the animal provoked? Did you enter the house? Did you try to go and take something from the dog or something? Or did you throw something at the dog or something? So most of the time, a rabid animal will bite unprovoked. But when a bite is provoked, it gives us an idea. That doesn't mean that it's not rabies, but it gives us an idea. So what we are saying is that there is the clinical signs of rabies. We want to remind ourselves that there is always aggression, there's always lethargy, there's always paralysis. The P stands for paralysis, the A stands for hypersalivation, and the A stands for abnormal vocalization, like we've already explained in our clinical signs. So the alpha signs are the signs that we always look out for when we are doing rabies investigation, or when we are doing, when we are doing dog bite investigation, when we are doing dog bite investigation. Now, the case flow, there are 5 steps. So the first is event notification. So once the you are being notified, once you get the news of any dog bites, you actually probably notify the next person in command. It can be your district boss, or can be in the medical section. We have people, we notify them of dog bites. And then after the notification, sometimes depending on the extent of the case, you can even have a rapid response team even to go out and do the assessment and all that. So the rabies assessment is done. And then we also do the quarantine. And then we go on after the quarantine, depending on the outcome, we do laboratory analysis. And then finally, we do we report to various stakeholders. So that is how the flow goes. So event notification, there's an assessment, there's a quarantine schedule, and laboratory results, and then report. So all this thing happens within a period of 10 to 14 days. That is why per our protocol, when there's a dog bite, we want to still observe the dog for 10 to 14 days, especially when the dog is known and is found. However, if the dog is not known, I think Dr. Komi has said we have to quickly, we assume that it's a positive case and we have to give all the 5 vaccines. But we've emphasized that we do this because we want to find other contacts, and then we want to also make judicious use of the post exposure prophylaxis vaccine, because we know that the human vaccines are very expensive. Most of the time, they are not even in our facilities, and we cannot continue wasting it when it's not intended for. Yeah. So event notification, we can get it from the general public. Sometimes, like I said, somebody just walked into our clinic and then notified us that her son has been bitten by a dog. We can also get the notification from hospital. So we have cases where a clinician may even link up with the local vets to, assuming you are in a municipality, it's always good to know the vet or the animal health professional there, so that when there is a bite, you link up and say, okay, I've gotten a dog bite. So if you could follow up and give me the results, after the period of quarantine. We can also get the notification from government and private vets and other stakeholders. In fact, there are so many dog bite cases that are even reported in the police stations. So most of these notifications they even come from there, because most people tend to legalize this whole issue. So that is why the One Health approach is very key when we are doing this integrated case bite management. It will amaze you that most of the dog bite case goes to either the chiefs, the assemblymen, the opinion leaders in the community before even it gets to the healthcare professionals. So these are all where we get notification from. Now, with the assessments, these are the 5 things that probably, so a suspect case, any animal that presents with signs of the alpha, so we've talked about the aggressiveness, the lethargy, the paralysis, the hypersalivation, and then the abdominal vocalization. So once an animal shows any of these signs, or in short, when there is a change of behavior of that particular animal, we suspect that that animal is a potential carrier of the rabies virus. So we look out for these signs of alpha, which is very critical. So when we are doing the investigation, the alpha signs is always at the back of our minds whenever we go to a house to do the assessment. And then 2, a probable case, a suspect case that has a history of contact to a rabid animal. So we have cases where most of the time when dogs have rabies, they fight with other dogs. So we have cases where a dog enters a house and bites all the dogs. And like we explained, if those animals are not vaccinated, after some few weeks, they will start showing signs of change of behavior. So if a suspected case, or if an animal that has bitten anybody, and then that animal has had a contact with a stray animal, especially when they are involved in a fight, it could be a probable probable case. And a suspect case that was killed. So in so many cases, we have like this story that I actually said. So this man killed the dog. So once the dog has been killed, you have nothing to especially when it's killed and it's buried and it cannot even trace, you have to treat it as a positive case because you don't have the dog to confirm. And we've always emphasize that rabies is preventable. But once clinical signs show, there is nothing that you can do. So that means that you need to make sure that that patient is vaccinated just to ensure that the person is protected from getting rabies. So it's very key. And especially when probably the suspect dog has vanished within probably 5 days or even 3 days. So if the animal has died, a dog bites you, and then within 2 to 3 days the dog dies, it's a highly a probable case of rabies. It's a highly, I'm not saying that it's a confirmed, but it's a highly probable case. So such a case, we have to get a sample, which is the head, and go and confirm in the lab to see if it's positive or negative. And now a confirmed case. Now we move to the confirmed case. So a confirmed case is an animal that has been tested positive in the laboratory. And then, like I mentioned, we have the gold standard test, which is the fluorescent antibody test. Maybe in the next 2 slides, I'll show how you can see the fluorescence when it's a positive case, showing the rabies, the antigens and all that. So the PCR test, which is a molecular test we do, once it's positive, we can now say that it's a confirmed case of rabies. Sorry. And then when an animal bites anyone and the animal stays alive after 10 to 14 days of observation, is a no case. So like Dr. Kobe mentioned, even if you have started with the first 3, which is termed the pre-exposure, and then the animal stays after 14 days and is alive and doesn't show any sign, what we do in the animal aspect that we ensure that the animal is revaccinated. So it's a no case because when the animal has rabies, within 10 to 14 days, even less, the animal actually dies on its own. Yeah, so once it's after 14 days of observation, it's a negative case of rabies. And an animal that is also tested negative for rabies using the gold standard test, like the PCR and the FAT, is also a no case. So even if you have started, what the IBCM seeks to achieve is that we save the extra 2 vaccines for someone who may need it, because we've earlier said that the vaccines are not always readily available. They are very expensive, especially when patients have to go and buy and all that. So we need to make this conscious effort to save the vaccines, to give it to someone who actually will be in dire need of the vaccine. So the assessment, we look at human exposures and animal exposures. So it is not only the human exposures that we look at. The reason why the IBCM is very critical is that we've always emphasized that 99% of all cases of human-mediated rabies is mostly through dogs. And when a rabid animal has rabies, or when a dog has rabies, what happens is that he normally fights with other dogs or bites other dogs. So in the process, we don't do only human assessment, but we also try to do assessments of the animals that have been exposed. So when the animals are exposed, just as we do for humans, we also revaccinate those dogs. And then when a rabid animal bites a dog, what we do is that we have to observe the dog not less than 6 months to see if the signs of alpha will show. Once the signs of alpha shows, that animal has to be euthanized, and then you go and test for rabies, because you don't want the animal to actually expose a lot of people through bites. Yeah, so we euthanize it during the period of quarantine. So there are 2 things I've said. One, if a rabid animal bites, if an animal bites anybody, or if there's a dog bite, we observe for a period of 10 to 14 days. By then, if the animal is positive for rabies, within these days, the animal dies. That's why we've taken our time to explain. Especially if it dies within 2 days, 3 days, it's a highly probable case. And that animal has to be taken to the lab to go and do a laboratory test to confirm, so that that person take the full exposure. However, if you have doubts about this, it's always good to finish the vaccine, because rabies has no treatment. But for us to save the vaccines for people who may need it, and genuinely, we have had cases where people cannot afford, and that's why people die. It's always good to preserve the extra 2 vaccines so that you give it to people that may need it, especially in emergency cases. Yeah. Now, the quarantine. Animals are assessed for signs of alpha. That's what, sorry, I think there's a slide. And then we put them in quarantine. So most of the time, we want to either, if we don't have a quarantine facility, we restrict the movement of the animals and prevent them from having contact with other potential animals. So you chain and then you isolate the animals, or you cage the animals. And what is very critical here is that you ensure that the animal has been provided with enough food and water. You don't starve the animal, because starving the animal can cause the animal also to die. So you don't starve it. We ensure that the animal is being provided with food and water, but you prevent it from having in contact with other animals. However, if we come and then we realize that the animal is showing any sign of alpha, we don't allow a quarantine period, because we don't want you to contaminate yourself. We don't want any more contacts or bites. So we quickly had to euthanize the animal and ensure that we go and test. And then once it's positive, the human is taken care of. And then now, if we have to do a ring vaccination for the other dogs, that is also done to ensure that the population is protected. So any animal that appears healthy for a quarantine of 10 to 14 days, like we said, is a no case, and it's a negative case for rabies. That is why in our protocol, dog bite protocol, we observe for 14 days for any sign of change of behavior. So if the animal is not showing signs of alpha, it's more of a negative case. And therefore, the clinician who is handling this case can either discontinue the rabies vaccine. And if the patient is probably showing any signs, nervous signs or something, we have to quickly consider other, probably other differentials we've talked about, because it's not always the case that it's rabies. So we need to also consider other differentials in order to save the patient. Laboratory confirmation. If an animal develops signs of rabies during the period of quarantine, we have to automatically take it to the lab to go and test. And we have the veterinary labs are there, which helps us in testing. Even Noguchi sometimes does it, but most of the cases, the animal labs are able to do it very very fast. And then, yeah, for us. So the animal is euthanized and samples are normally submitted for a confirmatory test. Now, this is just to show, I know some of us probably have not have opportunity to. So there's how the FAT goes. So normally a brain, a smear is actually taken. This is just to show you how so you can see the first picture here shows the first picture from where the microscope is, shows where the red light is, shows a negative sample. But with the one on my further right, sorry, my mouse is not moving. It actually shows the fluorescent light, which shows the antibody and antigen reaction, and it shows a positive sample. Yeah, so I think I've talked about this, the antigen test. When we do the antigen test, there's actually a field test that we actually do, but this is actually done by people that it's not anybody that has to do this. We veterinarians or the healthcare professionals that have been vaccinated or taking the pre-exposure prophylaxis are allowed to do. It's not everybody that is allowed to do this because of the exposure. And you need to be trained to be able to take the samples or the brain tissue right from the brain without even cutting through the head. And this helps us to be able to do the full diagnosis before these samples are taken to the lab for a confirmatory test. In fact, when you do this, it's able to give you in fact, you're able to sound an alert very quickly. Even when the laboratory confirmation is taking time, you're able to quickly inform stakeholders, and then a rapid response is actually taken to in order to save other victims that might have been exposed to the dog bite. Now, reporting. So, animal bite cases presented to health facilities are supposed to refer. So, this is where the issue is. There's always a need with all this knowledge that we are getting. There's always a need for us to collaborate between animal health and human health, especially when we are dealing with diseases like rabies, because you need the animal healthcare professional to be able to do the investigation, or even together with the rapid response team to be able to do the animal investigation. And once the confirmation is established, it helps you, the clinician, to know what you have to do. And like we mentioned, the person coming to the clinic alone may not be the only contact. We have seen cases where other contacts have been left in the communities, and these people, by the time we get them, they would have probably been showing the signs of rabies, which might be too late. So it's always good to collaborate and ensure that the One Health approach is used in dealing. So it's always good to actually refer the dog bites to the nearest veterinary clinics, so that they actually go further to the communities together, probably with the disease control officers and all that, to ensure that we get other contacts. When that one is done, we are able to save vaccines, we're able to save other contacts, and then we are able to also save life. So feedback is then given to the clinicians for necessary action. So like we said, in fact, saving of the post-exposure vaccines is very critical, because we have, personally, I have had a lot of cases where the people have just taken one dose and they come and say, we don't have money again to go and take the post-exposure vaccines. I want to believe that going forward, we have to look at all these things as healthcare professionals, because these rabies vaccines are supposed to be made available and accessible to patients that are actually being bitten by dogs. And at the end of the day, as they are made available, because these vaccines, for all that I know, are supposed to be free, but sometimes they are not available. Sometimes they are available, but they are not accessible. But going forward, we need to look at it, how best these vaccines can be requested and then probably stored in the various health facilities, so that patients that are in need of these vaccines can be given as soon as possible. Let's remember that giving these vaccines timely and or making the vaccines available is key to saving the person's life. Like we said, once the virus hits the nerves, or once the post-exposure prophylaxis delays and the virus hits the nerves, there's little that we can do to save such a person. So it's always good to collaborate to ensure that these patients are actually taken care of in order to prevent them from getting the rabies disease. So we have various means of reporting. I know the surveillance team is working on the events-based surveillance and all that. So very soon, and we all have various ways of reporting diseases in our various web-based and then mobile apps and all that. But we can still use our telephones and other things to report the dog bites, so that, or the confirmed cases, so that stakeholders will take appropriate measures in order to curb any rabies cases. In fact, I always say that something that is 100% vaccine preventable, we shouldn't have people still dying at this time of of the generation. We shouldn't have 21st century, we shouldn't have people still dying of rabies, because it's something that we can all prevent, and it comes with we collaborating as health professionals. So benefit of the rabies surveillance. So we can still find other rabid animals and remove them from the community. There have been arguments where people are saying, oh, we have to kill all dogs and all that, but we only take the rabid animals, because if you start killing the dogs, research have actually shown that you even spend more money, and then at the end of the day, most countries that have tried that have had more cases of rabies after they have stopped, because it's not sustainable killing dogs in every community. So you decrease animal exposures, because once you enact that investigation, animals that have been exposed are you quickly do a brain vaccination, and then you also decrease human exposures. In fact, this story will always be in my head, because I can't imagine if this a whole family that have been exposed were not taken care of. Maybe in the next 3 months, they'll be dying one by one, and then probably in Africa where we are, somebody may attribute it to a witchcraft or something, but it was actually as a result of being exposed. Thank God that this woman actually helped, and then as we followed up, it went all the way to save this family. So we reduce the unnecessary use of the PEP. It's something that is very critical. The fact that somebody has money to buy the post-exposure doesn't mean that when it's not intended for, because we always say that the vaccines, the human vaccines, are expensive and they are not available. So if we keep on giving the vaccines anyhow, we will get to a point whereby we don't have the vaccines even when you are in dire need of it. Ensure that PEP is given to expose or to confirm rabid animals. Identify additional bite victims. So these things are things that we've said over and over, and we'll still keep on saying this to help us ensure that this system comes to play. Now, I think for those of us that join late, we will still continue to say that when there's no bite, when there's no scratch, when there's no lick, there is no rabies. So rabies is only gotten through a bite, a scratch, or a lick from an affected animal. And we've established the fact that it's not only dogs that get rabies, but every mammal. So a goat, when you have a bite from a goat, when you have a bite from a pig, you have to treat it just as Dr. Komi said. The case management should be just like you are doing for rabies, because you never know. Because we've confirmed a lot of rabies in goats, in pigs, in cattle in Ghana here. People have put their hands in cattle and other things that have confirmed rabies. So we need to treat every animal bite as a potential case of rabies unless it's proven otherwise. We are still saying that vaccination is a key, vaccination of our dogs, and I'll still continue to say that once we have not eradicated rabies, the vaccination, I will always take it in two folds: vaccinating our dogs, which is very cheap and which is very practicable, and then also vaccinating victims that are bitten by rabies or bitten by dogs that are intended or bitten by suspected dogs is also very key in controlling rabies. And then we have to still continue to educate our public on the need to vaccinate our dogs. In fact, a vaccinated dog is always a soldier in fighting rabies, because we've established over and over that 99% of the dog-mediated or human-mediated dog-mediated rabies is human-mediated rabies is transmitted by domestic dogs. We'll still want to say that there should be a collaboration for us to be able to ensure. So health authorities, local authorities, and all that, we all need to collaborate if we really want to eradicate rabies by the global plan by 2030. Ghana, we need to collaborate. We need to ensure that the One Health approach is actually used when we are dealing with any dog bite or animal bite cases. Okay, so I think I've shown this picture over and over, but these are roles of various stakeholders. Dog vaccination, quarantine, laboratory testing is being done by the Veterinary Services Directorate. Health services are also to ensure that the pre and post-exposure prophylaxis and management and reporting of dog bites, yes, to various, they ensure that they manage the cases. Okay. Apologies. I think my screen has, okay. Okay, apologies. So I think I've ended my presentation. So healthcare workers are to ensure that they manage the cases when it comes to the clinics, and then they are also to ensure that the vaccines are made available for patients that needs them. And then the environmental health service are also ensure that they help to control the stray dog population in our communities. And then all of us, we have a responsibility of educating the public on the need to vaccinate their dogs, on the need to seek immediate medical attention when they are being bitten by dogs and any other animal, because today we've known that rabies is not gotten by just dogs. Are not the only mammals that get rabies, but every mammal can get rabies. So I think I'll pause here and I'll hand over to Dr. Anita. Thank you.
Thank you so much, Dr. Emmanuel Peku, for taking us through the last parts of our presentations. So we would want to go to the Q&A and respond to some of the questions. In the meantime, please be expecting the link to be shared for the posters soon from this time onward. So I'll read some of the questions and then our panelists would respond to them. Okay, Dr. Peku, please, you listed tail hanging as a symptom exhibited by the dog. What does it mean, please?
Sorry, okay. So I don't know whether, so normally you have a lot of nervous symptoms being exhibited by the dogs when they, but the tail hanger, I think I was referring to when the dogs are anxious or when anxiety sets in. I think if I remember, I was dealing with it when I was dealing with tips of preventing dog bites. So assuming you have a dog that has put its tails in the tail, it means that the dog is anxious, and such a dog can bite you when probably you go close to the dog. So yes, tail hang, if your dog is wagging the tail, it shows how comfortable the dog is and all that. So that is it's about dog behavior when we actually when probably we come in encounter with dogs in order to prevent the dogs from biting. So these are some of the measures, these are some of the signs I was trying to put across. If you see a dog wagging the tail, it just shows that the dog is comfortable and will not really bite you when you go close. But if a dog has put its tails in between the hind legs, such a dog can easily bite you when you go close to it because it's afraid and it's anxious. Thank you.
Okay. So we'll take the next one. Someone wants to know what the total population of dogs or cats or monkeys is in Ghana and the coverage of rabies vaccination. Have we reached our herd immunity? Yes. Can Dr. Pepe give us some insights on this? Thank you.
Okay, thank you so much. So for now, it's been a while since dog census have been conducted in the country. That is one thing that an animal health sector or the One Health team has to look at very critically. However, dog vaccinations Formerly, when veterinary services had their own funds in order to carry out various activities, there were nationwide vaccinations, which you have officers going throughout the whole communities to vaccinate dogs and cats especially. However, when the decentralization came, a lot of things have actually gone down. But there have been a lot of efforts. We have a rabies eradication plan whereby we are rolling out vaccinations in all parts of the country. So for now, every assembly or every municipality actually does his or her own vaccination as and when funds are made available. However, I know a lot of efforts are being put in place in order to procure a lot of these vaccines. In fact, we have a lot of NGOs that are supporting us. So we have NGOs like Mission Rabies, REWA, and all these agencies are actually supporting. So Mission Rabies, for example, is helping to do free vaccination, but now it's in pilot basis. It's in few districts in the country. But very soon we may have a cascade whereby probably every part of the country you will have a nationwide vaccination. So I wouldn't say that we've hit because the last assessment that we actually did, we realized that we've not been able to hit our herd immunity or our targets. We are still below the vaccination coverage. So there are more efforts. Stakeholders and other partners are coming to play to help us achieve that target. Thank you.
Dr. Biko, still on you. Someone wants to know if they have to wait for the alpha signs before they start vaccination. And then also a follow-up question. There are lots of stray dogs. So when someone eats kebab that was made from or prepared from dog that was rabid, can the person get rabies as well? Thank you.
Okay, so I think I'll start from the last question. So there have been documented cases where butchers who have probably killed rabies dogs have come down with rabies, because don't forget that we said the virus is found in the saliva and the nervous tissue. So most of the time you have butchers having small cuts on their hands and all that. You remember that we are dealing with virus. These are very minute pathogens we are dealing with. So a butcher that is preparing can get the infection if the person is exposed. It can even be through the mucous membranes of the eye and all that. However, if the dog is cooked, most of the RNA viruses like rabies will denature when it's heated above a certain temperature. So when the dog or the infected animal is cooked, you are saved, but the person preparing it may be at risk. Now, the second question is that, like Dr. Komi said, once we have not eradicated rabies, we don't want to waste chances, especially when the site of bite is probably the person has multiple wounds and all that. You don't want to wait. However, when you start your pre-exposure, the 037, and then after 2 weeks, then the dog is alive and the dog doesn't show any alpha sign, we discontinue, and then we save the next 2 vaccines for someone that may be in need. Yeah, so please, I don't know if I've answered the 2 questions. Hello? Okay. Dr. Anita?
Yes, please, I'm here.
Please, have I been able to exhaust the question?
Yes, so I'm going on to read some more questions.
Okay.
So is there a defined timeline for someone who has received the vaccine previously? So I think a number of people want to know, if you take the vaccine, the rabies vaccine full course, how long after would you need to do a full rabies vaccine immunization again if you are exposed? So maybe Dr. Komi can take that. And can I add the next question to it? So considering the high fatality rate, is it advisable to go ahead and manage as category 3 in the event of a deep bite from a vaccinated dog?
Okay, so thank you very much. On the average, you're looking at protection for close to about 3 years for somebody who has gone through the full vaccination or even the pre-exposure prophylaxis. So we are looking at about 2 to 3 years. For any category 3 exposure, even if that particular dog or the owner can show you, certification of rabies vaccination, because of the consequences of clinical rabies, treats with both the immunoglobulin and the vaccine.
Okay, so also to you, please, can you throw more light on how to give the vaccine and the immunoglobulin, and after how many days, how any number of days after so after when can you not give the post-exposure prophylaxis? I think that's what the question means. Yeah.
Okay, so let me start from when can we not? I think that we all agree that because of the fatality of rabies, anybody who presents to you with a history of dog bite, prioritize your vaccinations. I think it's better to even give it as pre-exposure rather than say that the dog had rabies. So there is no time during which, or there's no period during which you can see that after an exposure, you are not going to give the prophylaxis. It's better to err by giving the patients the vaccinations rather than denying the victim vaccination, and the victim ends up with clinical rabies. Somebody was asking how, or I should clarify how we give the vaccine and the immunoglobulin. Remember, I said that for category 2 exposures, it is the vaccine that should be given. And when you are giving the vaccine, it's either an IM route or the intradermal route. We spoke about the fact that it could be 2 sites or 1 site. If it's the intradermal route, we always say that you can use the insulin syringe, and if you are going to do 2 sites, you draw 0.2 mils. And then you will, and this is a technique, so you will raise the skin slightly, infiltrate 0.1 mils. Make sure you have a bleb. Don't press it down. Leave the bleb. And then on the other arm, you inject the other side also. If you are going to give the immunoglobulin also, remember that you're not going to give the immunoglobulin on the same site as where you are giving the vaccine. So if you are giving the vaccine on the arm, and then if the wound is on the arm and it's category 3, the wound is on the upper arm. If you are going to give the vaccine, you infiltrate the immunoglobulin around the wound on the upper arm, on the left side, and then you will give the vaccine maybe on the anterolateral thigh or on that side, or on the other shoulder. The vaccine and immunoglobulin should not be given at the same site. Remember, one is an antigen, one is the immunoglobulin, and you don't want the immunoglobulin mopping up your antigen such that it renders the vaccine useless. I hope I've made it quite clear. When it comes to the intradermal, it's a technique and a skill that is a training that we need to go through as compared to the intramuscular vaccination. So yes, there are guidelines for giving the intradermal route. There are some posters and job aids for that.
Okay. Okay, so can I read this question out? Just like the vaccine, the immunoglobulin is also expensive. Often on the shortage, you normally see people carrying prescriptions around. To achieve these IBCM goals, what are stakeholders doing to ensure that they are available to the public in our facilities? Dr. Piku, can you kindly take this?
Okay, thank you so much.
And let me just add this one. Sorry, can a previously vaccinated animal contract rabies? Thank you.
Okay, so let me start from that one. So yes, like we said, if an animal is vaccinated in an endemic area like Ghana, you need to boost the vaccination every year. So if you vaccinate your animal, say this year, and then you leave the animal for about 3 years, and it's bitten by a confirmed dog, you can get it. There are other protocols. So when, yes. Yeah, so you need to vaccinate your animal every year to ensure that the animal is protected against rabies, even when it's bitten by a confirmed dog. Now, we to ensure that we have vaccines available, we have to all look at this whole principle of the IBCM that we've all been introduced to. The human vaccines, I know that is part of the protein vaccines that the country procures, like the anti-snake and other primary vaccines that we use. So I think that we need to probably our directors need to look at this whole thing so that if possible, a request can be made to the medical stores in order to be able to get these human vaccines in our health facilities. It's one of the key things that we have to look at. For the animal vaccines, we always say that it's always available. It's always available. But most of the time, it's available for a small fee when probably you are not doing campaigns where it's being sponsored by organizations. So what we want to say is that this whole thing has to be looked at by the various, especially like I mentioned, the vaccines have to be probably Ghana Health Service have to look at it, because these vaccines we know they are available, but we need to ensure that every region or every health facilities gets these vaccines so that when people are in need of it, they are being given. When the IBCM is fully fully implemented, because sometimes the vaccines are there, but it will help to be able to ensure that these vaccines are used judiciously, because once the case are investigated and assessed, there's no need to probably give to continue all the vaccines when probably it's not intended. That is why there's a need for us to embrace this IBCM concept, so that once the collaboration is there, it helps us to safeguard or the use of the vaccines. Thank you.
Okay. Dr. Kumi, someone wants to know if a parent who cares for a child who was confirmed with rabies needs to take the rabies and post-exposure prophylaxis.
Once the child has clinical rabies, there is no need for us to give vaccines or give immunoglobulins. I keep on saying, once I see that, oh, that's not what I'm saying.
No, I think for the mother or the parent who cared for the child.
Just the parent who cares for the child has been exposed, I'm sure, to the saliva of the rabid child. So for that parents, we will also provide the post-exposure prophylaxis, not for the clinically confirmed patient. I don't know whether that's what we're asking.
Yes, please. Okay, so someone is asking, if a rabid dog bites a child and the child shows signs of rabies like hydrophobia for about 3 days, and the client visits your clinic, how do you counsel the patient? And do you have, okay, so basically, how do you manage the child, including counseling?
So we're talking about a patient with clinical rabies.
Yes, please.
It's important for all of us practitioners to understand that given our current situation or circumstances, rabies, clinical rabies is 100% fatal. As much as possible, knowing that this child over time may pass on, we need to manage more humanely. I'm sure my friends will say more, give the patient good quality care and let the transition be more humane. It also means that you may have to counsel the family for them to accept that there's nothing much we could do for this child, but to make the transition more humane. Hello? It sounds...
You can take this question again.
It sounds gloomy, but that is what some of us have been doing for some time now.
Okay, someone is asking again. That's why do you have to give the immunoglobulin and the vaccine at different sites of the body?
Okay, so I explained earlier on. One is the immunoglobulin, the antibody. The other one is the antigen. If you give them both at the same time, you have an antigen antibody capture, and you reduce the efficacy of your vaccine. So that is why they are not given at the same site.
Okay, thank you. Dr. Peku, if someone eats from the same bowl with someone who starts to exhibit the signs of rabies the following day, does the person need PEP or because of probable exposure to the infected person's saliva?
Yes, I mean, maybe the coming will. But you see, the person may not be able to even eat once there is salivation, because like we explained, all the nerves supplying the tank and other things are all damaged. So even the person will not even want to come close. Yeah. So so maybe Dr. Komi will ask something to it.
I think this is a far-fetched scenario, because as you can see from the video I gave, the patients who have clinical rabies will even shy away from water. How much more food? I always say that through my time at the fevers unit, there was only one patient we admitted who said had hydrophobia, but yes, he was drinking cocoa and other things on the ward. We discharged that patient quickly because that wasn't rabies. But for all those who came with the clinical signs of rabies, there was no way any of us could even attempt to have a meal or share a plate with that particular person. Having said that, I just want to chip in this before we all forget about it. But I'm sure from the discussions we've had, we've seen that the public education is an important linkage between rabies management, and that really needs attention. And I'm happy that the GMA, you've taken the lead in providing this platform for us to discuss this. We need to continue the public education, and I'm sure wherever we find ourselves, GMA, GRNA, GRNMA, the Allied Health Professional Council, all of us need to collaborate on these efforts until we make our backs head and force our various agencies to collaborate and make the One Health dream a reality. I don't think we will be moving far. I just wanted to add this before we drop off and I forget about it. Thank you.
Okay. Please, the post-test link has been shared, so kindly fill it. Thank you. So both Dr. Komi and Dr. Peku, is there a dose variation for a child and then an adult with respect to the vaccine and then the immunoglobulin? And then if Dr. Peku can give us an idea of the cost, or maybe Dr. Komi, the cost of the vaccine and the immunoglobulin on the market.
I will say that it ranges between 500 to about 1,000 Ghana cedis, both the immunoglobulin and the vaccine. So depending on where you're also buying from and whether what you have is WHO pre-qualified or not. So all these things come into play when we are getting the vaccines. Then there's not one fixed price on the market, depending on the brand you are getting and where it's also coming from.
Is it covered under NHIS?
Please no.
Okay. Is there any instance where the victim can still develop clinical rabies after they've taken the post-exposure prophylaxis properly?
Yeah, it's very, very important. That's a very important question. And I need to say this, that the vaccine should be maintained, or the cold chain must be maintained. maintain between 2 to 8 degrees. And most people tend to store the rabies vaccine in the doors of the refrigerators. You keep on opening this door, close, open, close, open. Definitely, it is not within the 2 to 8 degrees. Most places you can find some of the rabies vaccines even on the shelf. It means that we are not really, yes, the rabies vaccine may be available, cold chain may be broken, the person will follow the immunization schedule religiously, but the efficacy will be reduced and you may still end up with rabies. So it's key for all of us to make sure that the rabies cold chain, the vaccine cold chain, is maintained at all times from when we receive it as the pharmacy to when the patient buys it to when that is delivered to the healthcare worker and is administered. That cold chain must be maintained.
Takumi, I think we didn't respond to the question on the dose variation for adults and children for the PP.
0.1 mils intradermal for both adults and children. It's not based on the weight.
Thank you. So should a person still continue the PP post-exposure vaccination any day if he or she misses a day or two or even a week after the first dose with the schedule, probably because the person didn't have money to pay initially or something, I don't know. Could you respond?
We say that the vaccination schedule is almost 28 days if you stretch 28 days. So within that 28-day period, the patient should do well to receive the, if it's just a day or two, it might not be that worrying as compared to you take a dose today, the next one is 3 weeks time, the next one is a month's time or in 6 months time. Within the 28-day cycle, as much as possible, the patient should try and get the vaccine. It's also important, and I keep on saying this, that we encourage people to get the vaccines for themselves. Many a time you have a fight between the dog owner and then the victim. Dog owner says, I don't have money, and victim is saying that it's your dog that beats me, so you have to pay for it. I always tell the victims, let's look for the money, let's sort you out. When you live, you can deal with the dog owner over whether he has to pay or not. So let's encourage our victims to more or less try and get the vaccines, and let's help them with it. Thank you.
Okay, I think related to that point you made, there's a question here. If a vaccinated dog bites a patient, does a patient still need vaccination? And if so, wouldn't that discourage dog owners from vaccinating their dogs? Looking at the current statistics that shows that even most of the bites are from domestic dogs. Can you kindly take this question?
So it's advised that every year you vaccinate your dog at least once every year. Even if the dog is vaccinated, for the human being, once you have had an exposure that warrants vaccination, it's important that you take that vaccine because it may even serve as your pre-exposure vaccine. Hello?
Yeah, please, you're listening.
Yes, I was saying that it's important that even if there is evidence that that dog has been vaccinated, you should still go ahead and take your vaccine because that may be the first time you may be taking a vaccine. You could consider that as your pre-exposure vaccine or pre-exposure prophylaxis.
Yeah.
As for people not vaccinating their dogs, I'm sure if we are able to get our bylaws, our intersectoral collaboration between the environmental health, between one veterinary service, and people are prosecuted for not vaccinating their dogs, I'm sure that will also help so that you won't say, even if the person gets a bite, whether I'm vaccinated or not, I need to vaccinate. I'm sure Dr. Peku will throw some light on that.
Okay, thank you, Dr. Komi. So, yes, it's something that is why it's always good that every dog bite case, there's an assessment. Because if you do the risk assessment, and like I said, if the animal was not provoked and all that, you could leave a window and then make sure that you observe. However, looking at the pathogenesis and all that, when the assessment is done, especially when there are multiple bites, you don't need to wait. You have to do, and then at the end of the day, after 14 days, we still either continue or discontinue. So you still have to save some. So that is why we are saying that once you do the investigation after 14 days, the dog is alive. There's no need continue. So in that case, the person saves some money. However, vaccination of our animals is not key. Sometimes we have pet owners who vaccinate their animals and they still leave them to roam about. As part of the responsible pet ownership, we are supposed to keep our animals indoors or cage them or even chain them. We don't have to allow animals to roam. Okay, so as we are doing the dedication, we need to also educate pet owners that the fact that you vaccinate your animal doesn't mean that the animal should be free roaming, because that will also bring a lot of cases. So once you do the assessment and then the assessment doesn't show that probably the animal was provoked, doesn't show any sign, depending on the issue, you'll be able to either vaccinate or not. So I think that it's always good to investigate and ensure that the said animal is either showing signs, it's not showing signs, and all that. Yeah, thank you. Thank you.
Okay.
Hello, Anita.
So, yes, please.
Yeah, can I give a comment?
Yes, please. Yes, please.
All right, thank you very much. Yeah, thank you very much, Dr. Kome and Dr. Kompeku. That was an excellent rendition of all the aspects of the rabies case. I just wanted to probably add to what Dr. Peku is emphasizing at the end. I think looking at the numbers that we have today and the personalities, I think Dr. Kome also mentioned it, that are involved, GMA executives. The numbers that are attending this section is an indication of the gravity of the problem on the ground and how serious everybody takes it. And so I think I would want to add my voice to the fact that this education should not end just as we do see in many presentations, but probably an advocacy be formulated out of this for the enforcement. As for the rules and the laws, we have it. It is the enforcement of control of the stray dogs, which I think this education this evening, if possible, we put some right up to it and advocate for the enforcement of the rules to ensure that this thing is brought to maximum control. It is a disease that once the individual gets it, there is no cure. Once you start showing symptoms, there is no cure. And so with respect to even getting the immunoglobulins and the human vaccines, I think this advocacy can go in that direction also to enforce that we get it. In fact, human life must be valued in this country. And so whatever it takes, if we can push and put some energy behind it, that should be. And it is, I saw one of the questions on the platform, how efficacious. It is very efficacious. Look, the recent case we had at the unit where a dog bit all the family members. All of them went to get the vaccine as an immediate post-exposure. Only one person did not get. All of them have survived. Only that person did not survive. And so we cannot just hang around and say that people are misapplying the vaccines, and so we don't have enough. I think human lives are more valuable than that, and we should put much emphasis on that. So please, let's take it up. The last thing I want to mention has to do with the education or the I don't know it's coming from. With handling families who have had their relatives bitten and showing clinical signs. When they hear that there's nothing that can be done, pressure is brought on the health workers to bring in all sorts of concoctions because, it is very difficult for families to take the information that nothing can be done. And that also happened at the unit. Healthcare workers should be bold enough, should get the psychologists and the counselors involved to manage the family. Else, by the time you realize they are requesting to take the patient away to go and give all sorts of unrecommended concoctions and probably even take the patient to other places. So the counseling should be very keen on the family members so they can understand. It's difficult to explain why somebody is going to die, but that area is also very important. Thank you very much.
Okay. Thank you, Dr. Poklampo. He's also one of our panelists, so he'll be taking some of the questions. Dr. Peku, these two go for you. What is the observation period for animals, for rare instances like the dead and mammals, like the goats? So, for example, if somebody is exposed to a goat who is later found to be rabid, how would the management differ?
Okay, thank you. So the management is same. And like we said, for example, in my clinic or in our facility, we had a goat like that. That's the owner actually brought and was showing all the signs of alpha. And then the following day, the animal died. So once the clinical signs starts, the animal normally will maximum of 10 days. Most of the time, it doesn't even get to 10 days. But maximum, we give ourselves between 10 to 14 days. That particular animal dies naturally. Or he shows signs that are very classical signs of rabies and wouldn't want the animal to still live and expose other people or other animals. So we go ahead and then and euthanize the animal or kill the animal humanely, and then ensure that we test and then we take appropriate measures. So it's the same principle like how the dogs happen. However, the incubation period in cattle or, for example, in horses may take a longer time than in dogs, based on their body size and all that. But once clinical signs set in, they are between 10 to 14 days maximum, and the animal dies naturally. Thank you.
Somebody wants to know if an animal or a dog can be vaccinated on the same day that it is born.
Okay, thank you. So you can't vaccinate the animal that very day. What happens is that if maybe puppies are born, if the mother is vaccinated, it gets the maternal antibody, so it can protect it for about 12 weeks, and then you actually give a vaccine. However, we have had cases where puppies or animals under the age of 3 months are even coming down with rabies. So most of the time, the parents are not vaccinated. If the animal is apparently healthy, at 8 weeks, you can still vaccinate, but you need to boost the vaccination up after 6 months just to ensure that the animal is fully protected. Yeah.
Okay. Someone wants to know what makes the vaccination of the dogs difficult so that we can achieve a herd immunity. What's the challenge on the national scale?
Thank you. So the challenge is awareness creation. And I know most people until today probably didn't have much in-depth knowledge about how rabies, the pathogenesis and all that. So it's about the awareness creation and the availability of funds and availability of other logistics in order to ensure that veterinary services directorate also goes leads the agenda of vaccinating all dogs within our community. But first, I think is awareness creation, because we have had cases where even NGOs have sponsored and we are doing free vaccination, and you have people still not even enthusiastic about vaccinating their animals. So it's all about awareness creation, letting the public know how dangerous it is to live with animals that are not vaccinated. So it's all boils up to awareness creation or educating the public. And then we also upskill the various vaccination campaigns that we actually doing in our various municipalities. Thank you.
Someone wants to know if cats should get vaccinated, and you can add goats, rabbits, and others that we live with. Should they all get vaccinated?
Okay, thank you. So, like we mentioned, 99% of cases are dog-mediated. So, of rabies is mostly through dogs. So the focus now is on dogs. And then we know cats are also there. So we still vaccinate cats because we still have cases of rabies in cats and even monkeys. However, with other mammals like goats and other things, we don't routinely vaccinate them. But if a goat has been bitten by a rabid animal, we want to vaccinate that animal because rabies is vaccine preventable. So we'll vaccinate the animal. If the owner reports that maybe a stray animal has bitten the goats, you can do vaccination for the goat. But routinely, we want to vaccinate the dogs because per our data, 99% of all the cases are transmitted by dogs. So we want to vaccinate the dogs first, cats, and then most of the time we want to do monkeys. But for sheep and goats and other mammals, we don't routinely vaccinate them. Thank you.
Okay. So this one goes to Pope and Dr. Akome. Are the vaccines and the immunoglobulin given simultaneously? You've mentioned it, but if you could go back to it again. Do you have Dr. Akome?
Yes, Dr. Kome is here. So they can be given simultaneously, they can be given concurrently, but at different sites.
Yeah. Some of the questions have already been asked and responded to.
Yes.
So we are skipping some. So do you treat a verbal dog vaccination report? As in, if they say that the dog has been vaccinated, but you don't see the immunization card, how do you treat the right victim?
Anita, please, can you read it again? I didn't catch it, please.
Sorry. So someone wants to know that if someone gets bitten and comes to the facility and says that the dog that bit it has been vaccinated, but there's no evidence in terms of the vaccination card to prove this, how do you manage the person?
Always prioritize human life over the dog report. That is what I'll say. If I am bitten by a dog or anybody who presents as a victim, prioritize the victim. It is not the dog status and the dog's vaccination card is secondary to human life. So if you come to me and the person, even if the owner says that this is the current vaccination, I will encourage you to get the vaccine. I've told you that there are some people who say they vaccinated their dogs, but then maybe the cold chain was broken. So the dog may have a valid vaccination card, but then maybe the vaccine was not effective in that dog. So I will treat every dog bite category 2 to category 3 as a potential rabies case and manage the patient.
Anita, can I throw
Yes,
in
sir.
this?
Yes, please.
Have you heard about, maybe I'm sure Dr. Peku may say something, there are people who go around claiming they are vets, and at the issuance of, I think, 5 cities or 10 cities, are just quick to either sign or fill cards for people. There have been reports of people who just present cards which are fake, and they just probably paid for it to be signed to show as evidence that they have vaccinated their dogs, just because probably they've heard of inspectors coming around. And so, like Dr. Kome is saying, I think we should take such reports with circumspect and look at the victim and manage the victim irrespective of the claims of the owner. That one can be flawed. Thank you.
Okay, thank you, Dr. Comey and Dr. Yeah, so it's true. So that is why I will still emphasize that investigating every dog bite case is very critical, irrespective of whether the person has vaccinated or not, because vaccines can still fail. So we want to still look at the what led to the bite in order to establish a diagnosis, and then at the end of the day, we know how to manage the cases. So it's always very good. So yes, it's true. There are lots of people that are moving about. There are quacks that go about using other things even to vaccinate. That is why it's good that you ensure that you take your dogs to the nearest veterinary clinic, or ensure that whoever comes to vaccinate your dog is an animal health professional, either a vet or a para-vet. And then at the end of the day, you can demand an ID card from a person. And a person shouldn't vaccinate a dog with any substance when it's not in a cold chain. It's not vaccine. Some people even mistakenly take treatment for vaccine. Someone animal may be sick and maybe they may be giving some antibiotics, and he feels that, oh, he has vaccinated the dog. Rabies vaccines are done, and we issue a valid certificate for a year. And most of the time, the officer's stamp should be there, and then the signature, and then sometimes we even state where the vaccination was done. Yeah, so even if you have that, sometimes it's always good to contact the professional and ensure that that particular dog, there's an assessment that is being carried on to ensure that the dog is healthy. Thank you.
Okay, sorry, Dr. Peku. Someone wants to know what the alpha stands for. Can you kindly rehash that again?
Okay, alpha is just an acronym we use for the clinical science. So you have the animal may become aggressive without provocation. The L stands for lethargy. You have paralysis. You have hypersalivation, and then you have abnormal vocalization. So these are the classical signs we look whenever we are doing an investigation of a dog bite. You always look out for these signs. And like I said, the sure sign of any rabid animal is a sudden change of behavior, either an aggressive or a calm behavior. So in our investigation, we look out for these signs. And once a dog or an animal is showing these signs, it's a probable case of rabies. And we don't actually take it lightly. We either go ahead and euthanize that particular animal and take it to a laboratory for a confirmation. Thank you. Dr. Anita, please, are you there?
Dr. Peku,
Yes.
somebody
Yes,
asked a
yes,
question
sorry.
about whether an animal, a dog who is carrying rabies but has not started showing clinical signs, will still pass on the virus to another animal or human. So asymptomatic rabies.
Okay.
Any thoughts on that?
Okay, thank you. So everything is possible when it comes to the animal. However, we know that the virus gets to the brain before it goes to the salivary glands, and then it being released at the end of the day. However, you don't have to take any bite lightly, whether the animal is showing clinical signs or not. I would advise that you do the post-exposure things you've talked about, the washing and all that, and make sure that you go to the nearest hospital. Don't go to any pharmacy and go and take a painkiller, but just go and just treat it as a suspected case unless proven otherwise after 14 days. So it's possible that you may have such a case before classical sign, because there are cases like I talked about the paralytic fall. You may not see the animal becoming aggressive. You may not see any sign. Sometimes the animal will just isolate itself. So it's not always the case where you see the hyperactivity of the animal and all that. So sometimes, and most of the paralytic form, we actually miss them for a lot of things. So I would say that when you are bitten by any animal, it's a suspected unless it's proven otherwise. Yeah. Thank you.
I think another question for you.
Yeah.
If the dog has been vaccinated up to date and gets into a fight with a stray dog, must the dog owner go and revaccinate immediately?
Okay, thank you. So if the stray animal is confirmed and probably is more than, you have to boost the vaccination. If the animal is confirmed. In fact, we had a case in our locality where 2 dogs were bitten. One was vaccinated, one was not vaccinated. So after about 4 months, after about 4 or 5 weeks, the dog that was not vaccinated started showing signs of rabies. But this bitch that was vaccinated didn't show any sign. But if the vaccination has probably taken about 3 or 4 months, you need to boost it up. It's always important that you just like we do for a human, because if I've taken the pre-exposure and I'm bitten by a confirmed dog, I have to go and take the post-exposure, which is very it's a prerequisite. You can't say that I've been vaccinated and I've been bitten by a confirmed dog and you stay there. You have to go and take a booster, either 1 or 2 vaccines. It's the same with the animal vaccine. If the vaccination is probably over a period, you need to boost it up to ensure that the animal is protected. And like we said, it's always good to observe the animal for a period when you do the vaccination. Yeah.
Okay, so I think this brings us to the end of the webinar. So maybe some final words from our panelists, both Dr. Kome Peku and then as well Dr. Pokulampo, to end the whole session. Thank you.
So maybe I'll start. And thank you very much, and thank you all for joining this webinar. I've said earlier on that public education is the key to go. We've had lots of people on this platform today. It's where the seeds have been sown. Let's continue to have these public engagements in our churches, in our homes, in our WhatsApp groups, wherever we find ourselves as healthcare workers. The onus, because of what we have learned today, the onus is on us to make sure that we break this down and let people know. Like I said, if our backs are not heard, nobody will help us make sure that we have the anti-rabies vaccine and the rabies vaccine and the rabies immunoglobulin widely available. So let our backs be heard. Thank you.
Thank you. So I will continue from Dr. Komi, where you ended by saying the vaccines, the human vaccines should be made available. It's always good. I don't know if GMA can champion this, or Ghana Health Service should ensure that these vaccines are requested, because from the little that we know, the vaccines are procured. So it has to be made available in the various health centers. However, with the animal vaccines, we are also calling for a collaboration, so that when there are bites, once we collaborate, we'll be able to ensure that other contacts are traced and all that. So it's always good to contact the animal health professionals when there are dog bites, so that we ensure that this whole thing is being taken care of. However, we know that the human health has a lot of logistics when it comes to probably other logistics for campaigns and other things. So once the collaboration comes, I believe that we can all work together as One Health partners to ensure that we embark on, if the Veterinary Services Directorate is embarking on vaccination campaigns, the other stakeholders can support in order for us to ensure that we have mass vaccination. And we've all known that with mass vaccination, we will be able to break the transmission cycle. And it's our hope and it's our prayer that 2030, Ghana will also be part of the countries that will eradicate rabies. If not eradicate, at least bring it to a minimum level whereby people will not be so alarmed or will not be hearing people dying of rabies indiscriminately. Thank you so much. Thank you.
All right. I would like to say that we are in an election year. And we have this saying that say something when you see something. Say something. And these are things that we have all seen that it is very important. And we have all the stakeholders here and persons who can push in hard at policymakers. Please, let's take advantage of the election year and say something about this dire disease. Once you get it, you are going. It is not something that we should shelve. Let's say something about it, push and get it sorted out. Thank you.
Thank you very much to all our panelists for this very educative session. And we want to say a very big thank you to the Ghana Medical Association for hosting and allowing this webinar to go on at this time. Thanks also to all the participants who joined and those who've already left and those who are still here. We hope that you were able to learn something and upgrade your knowledge on rabies management in the One Health setting. And so please complete the post-test. The link has been shared in the chat box for your CPD points. Thank you very much and good night.